Hello, my dear friends. Welcome to Apollo 24/7's Health Hour. This is a show where we bring Apollo experts to the live chat show, and you can ask all your questions and queries on the YouTube chat. You must be watching this on the Facebook page or Instagram account and the WhatsApp as well. The YouTube channel as well of Apollo 24/7. So you can now ask us a question in YouTube. You can type down in the YouTube chat, and I'm going to ask this question to the expert who's going to join us very soon. On the show, we do have a health quiz where you can win coupons, you can win prizes, and we are going to give away some discount vouchers and coupons which you can use on Apollo 24/7, the app, through which you can book your lab tests, buy medicines, and also consult the physicians and the experts from Apollo hospitals. चलिए आज का टॉपिक हम बात करते हैं. We are going to talk about senior citizen wellness guide, and let's invite the expert for today, Dr. Amitava Ray. And Dr. Amitava Ray is more than 20 years plus experienced general physician from Apollo Multispeciality Hospitals, Kolkata. He specializes in the treatment of hypertension, diabetes, raised uric acid and dyslipidemia. And his awards and achievements are Keepers of Flame COVID Warrior Awards, and he is a professional member of Indian Medical Association and Medical Council of India. Let me welcome Dr. Amitava Ray to our show. Sir, namaskar. Welcome to the show.
Good morning.
Sir,
good morning
to you.
Yeah.
Wonderful having you back again, sir. So let's talk about today's topic, Senior Citizen Wellness Guide. तो पहले मैं आपको एक बेसिक क्वेश्चन से शुरू करना चाहती हूँ सर. कब हम लोग एक ह्यूमन बीइंग को सीनियर कैटेगरी में बता सकते हैं? What is the right age?
Yeah, any person who is more than 60 we can categorize as a senior citizen of any nation. But the thing is that with the senior citizens, we need to know that there are some physiological age-related changes that can happen with age. It is normal. These are the physiological normal changes. What is these changes that we can see have some vision impairment, we can have some hearing impairment, we have disturbed sleep with age, we have loss of teeth, change in the taste, decline in the function of lungs, heart, kidneys, there may be wrinkling of the skin, there may be reduction in the muscle strength, reduction in the bone strength, loss of bladder control, loss of appetite, reduction in the sexual function, and increased tiredness or fatigueness. This can all happen with age. So these are some of the changes which we can expect to happen with age. And instead, there are some risks in older patients. Various risk factors and their ill effects on elderly people have been identified. Like there may be some nutritional deficiencies that will result in reduced bone mass and immune dysfunction. Inadequate consumption of fibers and fruits that can lead to constipation. There may be the physical inactivity and the sedentary lifestyle. Being a retired person, that can lead to social isolation, loss of appetite, depression, anything can happen. Smoking that can cause again the diabetes, cancer, cardiovascular diseases and lung diseases. Alcohol consumption.
Let me ask you, sorry to have interrupted you. तो
जैसे
थोड़े आपने जो लिस्ट किया है ना सर, अभी आपने जो हमें बताया है, so these are considered to be natural progression of age.
Yeah,
and which we need not worry about.
Which may develop with age. कि अब हम retired हो गए, I have got no work to do, no morning work. This is a sedentary lifestyle. मैं सो रहा हूँ, उठ रहा हूँ. This can all lead to those, what I'm saying, the problems. This can lead to the substance abuse as well, alcoholism. Then आहिस्ता social isolation हो जाता है.
जी ठीक है. I see that our audience are joining in still. प्रकाश सिंह जी, आपने क्वेश्चन पूछा है, can we ask your age, gender and बाकी पूरे details भी दे दीजिए. To all our viewers who are watching this, please do type all your details like age and other problems that you have. वो भी type कर दीजिए. It will help Dr. Amitava to answer your questions better. So, sir, I will wait for some more people to join us and ask questions on the platform. In the meanwhile, while you were saying that there are certain things which are normal aging process, so how can we help a human to understand that this is normal and then take care of their health? इसके साथ क्या risk भी आ सकता है? For example, ये चश्मे जो है, this is very common and normal, and we have an aid to help us. So let's identify things that you can handle, and there are things which you can be at risk with.
Yeah. The thing is that, as you can say, हम लोग जो चश्मा पहनते हैं, there is the visual impairment. What are the age-related problems? क्या क्या होता है? First of all, there will be some visual impairment. Usually,
ठीक
with
है.
age, near vision may improve, but the distant vision goes deteriorates. So हमको देखने में तकलीफ हो रहा है, सामने वाले को पहचानने में तकलीफ हो रहा है. तो what happens? If I am not hearing properly, so आहिस्ता आहिस्ता मैं अपने आप को हटा लेता हूँ. There is a social isolation as a result of this hearing and visual impairment process. उसके साथ क्या होता है, थोड़ा थोड़ा with age what happens, हम लोगों का सभी के घर में जो माँ बाबा या भाई चाचा चाची है, what happens is that there is a risk of falls. अगर वो फॉल गिर जाता है, तो गिर जाता है मतलब what happens is that with age the bone strength also reduces. There is bone remodeling reduces and that causes the fall. और इसके लिए पेशेंट पड़ जाता है. But what we can do is that अगर पड़ गया तो there is easily fracture of the bones. So what we advise is that assist करो, elderly को accompany करो जब वो walk करता है, bathing करता है, toilet, and they should be informed and totally educated about using the aids like the walking stick, जो walk calipers होता है उसके साथ walk करने में. If they can be trained and they can be provided with those, we can minimize the risk of the falls and injuries that can happen. And others में जो
important point you stated sir, कि हम ना कभी कभी देखते हैं सीनियर्स को जो जिनको लगता है कि I shouldn't be using all of this. They self respect का issue होता है, but then for me I understand that giving them that aid is not hampering their image, but it is helping them to move and confidently.
मैं कहना चाहती हूँ, I have to, since I am a senior citizen, I have to accept my age and respect my age, and I have to take these aids to minimize the complications. Second is that, ma'am, what happens is that there are certain factors which we can't control. The extrinsic factors, the intrinsic factors are there behind the fall. Extrinsic are the outside factors. What happens is that we have a slippery bathroom, unsafe kitchen, there is some slippery staircase, poor lighting, inappropriate use of walkers and crutches. These are all helping the patient to fall down. And there are certain diseases, acute severe illness, patient may have vertigo, dizziness, this is causing her to fall down. They may be having some arthritis problem in the knees, and so they are unable to walk properly. So all these things can cause the fall down. Thirdly, there may be something that may be related to the foot problem, like there may be related to the vision and hearing. There may be some weakness of the muscles. This may all contribute to the fall down, which they can't control. These are due to diseases. But there has to be somebody who has to accompany the person during or help them during while going to the toilet, bathroom. And there always has to be some side rails starting from the bathroom to the toilet, even when in the latrine, so that they can be support system should be there, so that they can support themselves and get themselves upright. Regarding the fall prevention has to be done. That is the
wonderfully answered. So in related, here's a related question, sir. इनका नाम योगी टेक है. सर, माय फादर 65 ईयर, उनका डायबिटीज है और वो सुबह शाम वॉकिंग भी करते हैं और उनकी डायबिटीज कंट्रोल में रहती है, बट उनके नीज में दर्द रहने लगा है. उसके लिए कोई सोल्यूशन बताएं. तो सी, एज यू वर सेइंग कि एज वी एज थोड़ा वो मोबिलिटी इशू आता है, बट व्हाट वुड बी द रीजन फॉर दीज मोबिलिटी इश्यूज, और आर्थराइटिस की तरह या बोन डिजेनरेटिव डिसीजेस क्या क्या होते हैं?
What we are saying that these are osteoarthritis. These are due to bone degeneration. Bone degeneration with age, as I was telling you, there will be some normal bone degeneration with age. ये होता ही है. Females में ज़्यादा होता है, males में थोड़ा कम होता है. But the thing is that both the individuals are affected. But if it is not a rheumatoid arthritis, these are all osteoarthritis mostly. So this has to be taken care by physical rehabilitation, by exercises, by what we are saying, the aids, whatever physiotherapy, rehabilitation therapies that has to be done to get the maximum functional ability. And afterwards, if it is advisable, if the surgeon advises, then the total knee replacement or other surgeries that can be done can be taken care of as a last resort. Other
Yeah.
medicinal treatments with steroids and everything can be done, but that all under medical supervision. But the first and primary thing is that application of ice packs and local exercises, strengthening your thigh muscles. This can help in reduction of the knee pain.
राइट, सो लेट्स टॉक अबाउट एक्सरसाइज. जैसे इन्होंने बताया कि उनके फादर डायबिटीज है, डायबिटिक है, पर कंट्रोल में लेते हैं बाय डूइंग एक्सरसाइज, बाय वॉक करते हैं. तो हाउ इम्पोर्टेंट इट इज फॉर आवर एल्डरली टू बी मोबाइल एंड कितना वॉक चाहिए उनको?
देखिए, तो एज पर उनको थोड़ा वॉकिंग एट ए पेस विच इज कंफर्टेबल फॉर इट, दैट इज एडवाइजेबल फॉर द एल्डरली, एंड इट शुड बी अराउंड 150 मिनट्स अ वीक, 2.5 घंटे हफ्ते में, एंड 5 consecutive days, yeah, not more than 2 days of without walking. What this does is that it promotes the bone reabsorption, bone remodeling में थोड़ा हेल्प करता है, मसल टोन भी ठीक रहता है, तो दर्द वगैरह थोड़ा कम रहता है, एंड पर्सन ऑल्सो फील्स, सोशलाइजेशन भी हो जाता है, सबसे मिल करके कोई बातचीत होता है, तो दे फील विद इन द सोसाइटी. Walking is not only for the health, walking is for the mental health as well. When we meet people, when we feel comfortable, ये patient रहेगा कि he's within the society. ये society का, I am not being isolated. The sense of isolation भी walking करने से, थोड़ा बाहर जाने से कम होता है.
राइट, वो बहुत अच्छा पॉइंट आपने बताया है कि एंजाइटी, आइसोलेशन, सोशली इंटरेक्शन की वजह से कम होने के चांसेस है. Wonderful. So we'll come back to that anxiety and problems with mental health a little while later. I want to ask you next question. प्रकाश सिंह जी ने मुझे आंसर नहीं दिया है कि उनके एज के बारे में, बट ये लेते हैं Risdion LS and Soltus OD 200 for last 4 years. Is there any side effect of the above mentioned medicine? So मुझे ये पता भी नहीं है कि क्या medicines है, but generally हमारे I see that all our elderly are afraid of taking medicines because they're afraid of taking medicine because they're afraid of the side effects.
Yeah, the thing is that I think these are the whatever you're taking. He has told some brand names, I'm not there, but this has been prescribed by some psychiatrists for depression and anything. So any medicines that has been there, both the pros and cons of every medicines are there. Of every treatment is there, but there are side effects, negative effects. Yeah, but if the positive outcome overweighs the negative outcome, then only we proceed with the treatment. In case if you feel your beneficial effect is more, I would request you, sir, if the beneficial effect is more, you can persist with the treatment and you consult your physician who has advised these things. I don't know the background of these prescriptions, but you can consult him. But if the positive effect, my thinking is that if the positive effect overweighs your negative effect, then it is better to continue with the treatment.
पर सर एक और बात है, मुझे बहुत ही इम्पोर्टेंट लगता है कि सीनियर्स के साथ हम लोग, स्पेशली केयर गिवर्स, चिल्ड्रन और एनीबडी एल्स हु इज टॉकिंग टू देम, इट इज इम्पोर्टेंट फॉर अस द केयर गिवर्स टू टेल देम द इम्पोर्टेंस ऑफ द मेडिसिन. ये किस लिए हम दे रहे हैं एंड क्या करता है, और कैसे इसका हो सकता है कि वो ध्यान रखे कि अगर कोई साइड इफेक्ट है तो बताए सही ढंग से. तो दिस काइंड ऑफ अवेयरनेस इन डिटेल हम शायद हमारे अडल्ट्स को बताते नहीं, बस ले लो बिना पूछे बोलते हैं. सो आई थिंक वी नीड टू बी अ लिटिल मोर.
It's a valid point which you're saying, but say if somebody is taking antihypertensive medicines, these do have its side effects, but these are the side effects which we cannot control and which we can control. So some side effects, which are rare side effects, usually when that happens in the, say a person is taking a beta blocker. So it's very little side. It has a very rare side effect and a very minimal side effect of erectile dysfunction. Usually, we say when we prescribe a beta blocker, we discuss about the reduction in the blood pressure or reduction in the heart rate, or we tell them about the benefits of the of heart on the heart about this medicines, the keeping the heart rate low, myocardial oxygen demand कम होता है वगैरह वगैरह. But as you said, usually we don't discuss the reduction of the erectile dysfunction or the sexual dysfunction. We usually don't discuss. These are some things I agree. I take up on bit. There's hands up. So we usually, because it is a very rare and a very we think that it is unimportant. That is why I agree with you. We don't usually discuss, but this should be discussed. Usually we skip this type of discussion because we feel
Correct.
age 60 this is not as important. But as you
Correct.
said, I agree with you, Jay. My
Right.
thinking does not play with always the patient thinking.
All right. So Dr. Amitava Ray can be consulted on Apollo 24/7. उनका link हमने chat box में दिया है. So somebody who thinks that you require his consultancy in detail, please do consult. Chat box में उनका link दिया गया है. Also, sir, one quick question before I take up the next question from the viewers. तो
Yeah.
क्या क्या टेस्ट करवाने पड़ेंगे मुझे अगर मेरे घर में कोई सीनियर लाइक माय मदर माय एनीबडी दैट आई एम टेकिंग केयर ऑफ, एनुअल टेस्ट क्या करवाने पड़ेंगे और जो एग्जिस्टिंग कोई डिसीज है तो उनको कब कब मॉनिटर करवाना पड़ेगा?
If the patient, first of all, we need to see एक एक करके देखना है. CBC we usually see that no, don't take the CBC into consideration. कभी कभी क्या होता है elderly patients का एनीमिया हो जाता है due to various reasons. Due to various but the thing is that if the hemoglobin percentage is less than 10 in case of elderly patient, it has to be treated. Second is the routine blood count. We can get a idea about the patient's total blood count, whether she or she has an infection. A routine blood count, a routine urine examination should be done at least in case of females twice a year or thrice a year if the patient is asymptomatic for any urinary tract infection. A routine screening of sugar levels should be done even if the patient is non-diabetic at least once a year.
Okay.
At least once a year to twice a year. A minimum once a year if the patient is don't have any comorbidities. Renal function has to be assessed once a year. Lipid profile has to be assessed once a year. Liver function uric acid has to be, because of the pain and every sufferings has to be reduced. Uric acid has to be checked. Liver function needs to be checked. ECG, basic ECG has to be done regarding the cardiac function. Radiological exposure, if the patient doesn't have any problem, then don't go for the chest X-ray for radiological exposure. If the patient have a problem, then only with advice. But otherwise, this routine checkups of blood, urine, routine blood examinations of sugar, cholesterol, uric acid, liver function tests, these are enough to give us an idea what if anything new is happening in the home.
Right. Wonderfully explained, Dr. Amitava Ray. Next question I want to take is Mr. Devdas Thakur, 67-year-old male hai. It strains on my legs when I walk. Please suggest what I should do to lessen it. See, I'm coming back to these arthritis questions again and again. I think mobility is a major problem for our elderly.
Yeah. So better, that is what we were taking. A physical medicine or a medicine personnel should be consulted if it has got no structural deformities. Say the bones are not affected. If there is not a fracture pain or a muscular pain, as you said that there are some muscle pains may be there. Vitamin D, uric acid deficiency, rheumatoid arthritis may be the cause. If the medicinal causes are present, then you have to consult a physician and treatment should be done accordingly. But if the medicinal problems are not present, if it is a normal happening, then it is better to consult a physical medicine person, follow the rules of the exercises, whatever he's saying, and according to do some physiotherapy that will help you minimize the pain.
Right, sir. So this is Dasri David, 66-year-old male, type 2 diabetes है, hypertension है, CAD SPPCI 2017 में हुआ है, under regular treatment with the specialist in Apollo itself. So please do advise on maintaining or improving muscles and resistance. Sir, while we talk about exercise, जरा आप मुझे बता दीजिए.
Improving what is it?
Improving muscle and resistance.
Okay.
Strength, basically, muscle strength.
Yeah. What we suggest is that he's a patient of what I can say, diabetes, hypertensive. He's a patient of post permanent pacemaker implantation, and CID under the treatment of the cardiologist. So he can basically, it's whatever, he's under a good hands. So what I would suggest is that for the physical exercises at home, I'm always saying the physical medicine person would be the better person. But the freehand exercises, simple like stretching, simple stretching of the arm, simple bending, the freehand exercises that can be done safely at home. So that, but the thing has to be kept in mind that if bones are fragile with age, it can happen. It will happen to me as well. So avoid any exercises that can cause injury at the minimum, so that it doesn't cause any stress fracture, so that it doesn't cause any vertebral bone fracture. So it is better to do it under the whatever freehand exercise that can be done, simple stretching, forward stretching, backward bend movement, forward sideward movements. These are the simple exercises what we do at home that is sufficient to maintain the skeletal health.
If I remember last time that you were talking about the wellness guide and the New Year episode that you were suggesting कि walking से बढ़िया कुछ और नहीं मिलता है, वो free है और चलते रहो. So how good is this for our senior citizens?
Yeah, that is what I was saying. Walking at your own pace can always help to improve the well-being. Because say if I'm regularly walking 30 minutes, I know I'm physically fit person because I can walk at 30 minutes. I don't need anybody to go for assistance for going to the toilet. He will be confident enough that he doesn't need for anybody to assist him while eating because he can walk 30 minutes by himself. So again, his self-confidence is going to improve. Say, थोड़ा गया, थोड़ा बाजार में से कुछ हल्का सा कुछ खरीदा, किसी से बात किया, this all helps him to interact and he can get the news of updated about the social news, घर आसपास क्या चलता है. So that will all make him feel good and feel happy and feel physical. See, unless and until one person is mentally fit, he is not going to be physically fit. So we have to take these things into consideration. So walking is as you said, madam, I fully agree with you. Walking is the best sort of medicine because it doesn't have any risk or minimal risk.
Right. So can I move on to the next question, sir? I shall ask this question. Sorry sir, just a second. Sir, राहुल पूछ रहे हैं, डैड का उम्र है 78 year old, उनको डाइजेशन की बहुत ज्यादा प्रॉब्लम है, काफी सारे मेडिसिन हमने ट्राई किया है लेकिन कोई फर्क नहीं आ रहा है, कुछ सजेशन दीजिए. सर, एल्डरली एंड डाइजेशन पुअर हो जाना इज अ वेरी वेरी कॉमन थिंग सर. सो हाउ डू वी एड्रेस दिस और उनको डाइट में खास क्या देना चाहिए?
सो द सीनियर सिटीजन जैसे हम लोग बोला, इट शुड बी वॉट एवर डाइट. अगर ये डाइट को लेकर के सीनियर सिटीजन में थोड़ा चॉइसेबल रहता है, what is that we have to understand that how many calories is required. With age, we have to see that the mobility of the senior citizen reduces. The energy demand also reduces. The metabolism reduces. So the total calorie is also reducing. So we have to take it into consideration. We think that we say that 30 to 35 calories per day is the total per kg per day is the total
per
energy
kg per day.
Per kg per day. And we usually say that whenever we are saying about the fluids, it is about 30 ml per kg per day, the fluid intake. And protein requirement is 1 gram to 1.2 gram per kg per day. And oil requirement is that we say that oil should not exceed more than 20 grams, that is 4 teaspoons for it in all forms. And the salt should be at least 2 grams per day. And foods which we give to the senior citizens, this should include foods like cereals, millet, pulse, nuts, and oil seeds. Anything eggs, poultry, and fish if non-vegetarian. In case of vegetarians, we can give seasonal fruits and vegetables, low-fat milk, and milk products. Better to give them small portion sizes consumed frequently throughout the day so that they should be easily to digest. Healthy, easy prepared, and easily digestible dietary options are the best. And if the person cannot, some appetite stimulants can be given, like which we call clove. Some company can give him ajwan, methi. We can give haldi. These are all garlic, ginger, onion. These are all black pepper, elaichi. These can act as a mouth freshener, and these can boost all these, can stimulate the appetite and promote digestion, and this can boost our immunity as well. Elderly with chewing difficulties can have soft cooked vegetable foods like vegetable pulao, upma, seviyan, poha, khichdi, vegetable idli, uttapam, kheer, makhan porridge, dhokla, dals, paneer, soft fruits like banana, etc. These can all be given in case of requirement. Elderly people, if you want to avoid constipation, better to have a high fiber diet. कुछ भी राजमा वगैरह में बहुत ज़्यादा फाइबर्स होता है, बीन्स में बहुत लंबा लंबा फाइबर होता है, सो दिस कैन एड इन द डाइजेशन एंड कॉन्स्टिपेशन एज वेल. और डाइजेशन के लिए जैसे मैंने बोला, इजीली डाइजेस्टेबल फूड, उसके साथ आजवान, मेथी, थोड़ा क्लोव वगैरह जो एपेटाइट स्टिमुलेशन डाइजेशन में हेल्प करेगा, एंड इन दैट इसके साथ वी कैन ट्राई द मेडिसिनल ट्रीटमेंट्स एज वेल.
सर यहाँ पर मैं थोड़ा आई वांटेड टू शेयर माय पर्सनल एक्सपीरियंस एज अ केयरगिवर टू somebody who is an octogenarian. My father passed away at 85, so it was so interesting to see how his dietary habits had changed once he had become senior. So he reduced the intake, gradually reduce हो गया, but for me as a caregiver, what to give in that reduced intake कि कितना मैं nutritional balance करूँ, वो बड़ा challenging हो गया सर.
हाँ, मैं वही बोला कि
कॉन्स्टिपेशन एक सबसे बड़ा इशू, क्योंकि उनका खाना पोर्शन बहुत कम था, मैं उसमें कैसे प्रोटीन ऐड करूं, कैसे फाइबर ऐड करूं, बड़ा चैलेंजिंग था सर.
Yeah, that is what I said. What we said that whenever we can give, it's a challenge we can give. Say you have any vegetable soups that can be given. What I said is that when the body mass reduces, say a person like me who is about 75, 80 kgs old, when my body mass reduces to 60 kg, then my energy requirement or calorie requirement is also reducing. So it reduces drastically from 3,000, 2,500 calories to 1,500 calories. So your
Right.
total dietary intake is also reducing. That is what I said. That when the metabolic, you have in a aged person, the metabolism reduces, the physical activity reduces. All this reduces the calorie demand. So his calorie demand is less. We are thinking as a caregiver that he is not eating sufficiently, but to his extent he is fulfilled. We try to push things. That is when the indigestion things happen. He may feel bloated, he may feel discomfortable, but the thing is that we have to just think about the calorie intake. So whenever you can think that say my body weight is reduced to 50 kgs, and you are only thinking about a 1500 calorie diet, सो 1500 कैलोरी आपको लेना है, तब आपको थोड़ा, मैंने जैसे बोला कि सॉल्ट 2 ग्राम रखना है, ऑयल्स 20 ग्राम्स रखता है. एज ए केयर गिवर इन अ होम, वी हैव टू ओनली थिंक कि हमको 20 ग्राम्स रखना है, 2 ग्राम्स इसमें रखना है. गिव हिम अ लॉट ऑफ कलर्ड फूड्स सो दैट ही कैन गेट अट्रैक्टेड. नेचुरल जो फूड कलर्स आजकल मिलता है, यू कैन ऐड टू दैट. दैट विजुअल इम्पैक्ट ऑल्सो क्रिएट्स अ साइकोलॉजिकल इम्पैक्ट कि उनका खाने में अच्छा लगे. जैसे मैंने बोला कि थोड़ा क्लोव, गार्लिक वगैरह थोड़ा स्पाइसी करके, बिकॉज वी हैव टू अंडरस्टैंड दैट हिज टेस्ट सेंसेशन इज रिड्यूसिंग. दैट इज व्हाई हिज
that was one important question that you have raised कि टेस्ट बड्स गायब हो जाते हैं या कुछ भी टेस्ट अच्छा नहीं लगता है उनको. मेमोरी में एक टेस्ट है, एक्चुअल में एक टेस्ट है, एंड दे आर फीलिंग समथिंग एल्स. दिस इज सच अ डिफिकल्ट.
डेंचर में प्रॉब्लम होता है. देर इज टूथ लॉस, इल फिटिंग डेंचर्स. जो भी डेंचर्स अब दो, इसको भी हम लोग डरते हैं कि कहीं एस्पिरेट ना कर जाए, वो डेंचर अंदर ना चली जाए. दिस ऑल आर कंट्रीब्यूटिंग टू द फैक्टर्स दैट आर रिड्यूस्ड डाइटरी इंटेक. सो इन दैट केस माय सजेशन इज दैट जितना उनको खाना वो चाह रहा है, लेट अस नॉट पुश थिंग्स इनटू इट. जस्ट वी हैव टू बी कॉम्पैशनेट. लेट अस थिंक दैट ही इज नॉट फील डिप्राइव्ड. हाई कैलोरीज डाइट दीजिए, जो उनको अच्छा लगे वो खाने लीजिए. एक दिन के लिए अगर आइसक्रीम लेता है, हम लोग सोचते हैं कि ठंडा लग जाएगा, इसको बुखार आ जाएगा. डोंट थिंक अबाउट दोस थिंग्स. एक दिन के लिए अगर किसी को थोड़ा मिठाई भी खाना है, डेजर्ट्स खाना है, क्या फर्क पड़ता है? केक, पेस्ट्री एक दिन दे दीजिए, कुछ फर्क नहीं पड़ने वाला है. ना शुगर लेवल में कुछ होना है और ना, बिकॉज the treatment target also changes. Whenever a patient is 80 years diabetic patient, we are not thinking about HbA1c about 6.5.
Correct.
We have then raised the age treatment level to HbA1c 7. I will be happy anything less than 8 if the patient is above 80 years old. So in that case, all the things relaxes a bit.
Right, sir. So it's age appropriately आपको calculate करना है, not just the chart appropriate figures.
Yeah, age up and let the patient be happy. And आपको माने just you do a mental mapping. Easy taking a 1,500 calorie diet, easy taking a 2,000 calorie diet. अगर करना है तो एक बार किसी से चेक करवा लीजिए, डाइटिशियन से, जो कैलोरी इंटेक क्या करना है, 1,500 कैलोरी हमको रखना है दिन में, मिक्स पोर्शन में एक बार आप चार्ट बना दो, बस that is good enough.
Right. All right, sir. So next question is from Mr. Uday Shankar Prasad, who is 60-year-old and just retired from profession. He is not diabetic. Since last 1 year, I'm facing pain in the lower back and knees. Tests and physiotherapy have been done, but I don't have much of relief. So somebody who is just entering the seniority, ये अभी कैसे control कर पाएंगे? ये muscle strength and bone strength को क्या maintain कर पाएंगे?
Strength and bone strength, but this is not reducing even with exercise. He has to see whether there is any neurological causes. जो bone compression के लिए वो कोई nerve irritate हो रहा है कि नहीं. I think in this case he should consult a physician or a neurologist who can. This NCV of the limbs has to be done, nerve conduction velocity. Then only we can comment upon it.
Okay. But yes, one positive thing, Mr. Uday Shankar ji, pain के साथ you do not need to live life right now because there are a lot of other options. Now easier options, early interventions इतने सारे आगे हैं that you will be able to find the right treatment for yourself. Please do keep watching our space here. Health Hour keeps bringing interesting discussions with experts with newer therapies as well. And one more thing, keep introducing exercise. Keep yourself mobile, sir, and that's going to take you a very, very long way and a healthy way. So, next question that I want to take is Mr. R.K. Singh. R.K. Singh ji, 56-year-old hai, and he has cataract. Can I avoid surgery? I recently had a gallbladder surgery. Now I am not ready to have another surgery. So, ये थोड़े सर्जरी का फियर बड़े लोगों को ही नहीं सर, काफी सारे एज ग्रुप में सर्जरी का फियर है, एंड मोर सो ओवर इन सीनियर ग्रुप. How can we reassure them?
Yeah, surgery is required because if vision is impaired, starting from the risk of fall, there is a lot of complications that can happen. So from social isolation, because if you are not able to visualize properly, you can't recognize a person by name or by face.
Correct.
Yeah, so there will be a lot of problems, sir, if you don't do the surgery. And I'm not an ophthalmologist, I'm not an expert in eye, but so far as my knowledge goes, for cataract you need a surgery, and it is better if it is done very early. And nowadays cataract surgery is done in a daycare basis. You get same day discharge is being done. I don't think there is much of a risk involved in the surgery. Like gallbladder is a bit lengthy one, but cataract surgery, I don't think there should be any complications or there should be any hassles regarding that. You should go for it.
Absolutely. So I've seen a lot of people getting their cataract surgery. ये तो surgery की तरह रहता ही नहीं है sir. The pain is minimal. The care is minimal.
Yeah. No stays. उसको सुबह दिनों दिन बढ़ती होता है, हाँ, you need to control your sugar. पहले से प्री ऑपरेटिव चेकअप करके आपको प्री ऑपरेटिव फिटनेस करके रखना है. You need to control your sugar, your blood pressure. अगर जो हार्ट का दवाई कुछ चल रहा है, कार्डियोलॉजिकल फिटनेस लेकर के उनसे बात करके एंटीप्लेटलेट बंद करना पड़ेगा, वो सब ठीक है. बट व्हेन द पेशेंट इज एडमिटेड, हम लोगों ने कलकत्ता में देखा है कि वो 9 बजे एडमिट होता है, 3-4 बजे तक घर चले जाते हैं. इसमें कुछ प्रॉब्लम.
Correct. Right. Wonderful, sir. And there are certain things that you cannot avoid and you have to get, जैसे डॉक्टर अमिताभ बोल रहे थे कि विजन बहुत important है for you to stay stronger and healthier and to be active in life. Yeah. So no compromise there. Please go get your cataract done, sir. Next question I want to ask you is about constipation and seniority. क्योंकि ये लोग ज़्यादा खा नहीं सकते, फाइबर कम होता है, ज़्यादा मोबिलिटी नहीं होता है, bowel movement पे भी ये काफ़ी सारा इफेक्ट दिखाता है. So how much of constipation, like what can be an acceptable limit, कितना bowel movement होना चाहिए? I saw my parents worrying about their boil all the time. ये तो हमारे घर में पीकू स्टोरी है सर.
Yeah. So as you said, there is some psychological factors also as well, where when we in fact it will happen to be as well when I age up at that
I
age.
know.
There is nothing to be ashamed of. The thing is that if something is in the psychological as well, and something is physical, which we do treatment. Yeah, we usually prescribe drugs in these cases. There are lots of laxative options available. Only its side effect is that it may develop intolerance on a long-term basis, and there is some dependence. But there is a lot of options nowadays available where we can give the drugs. But yes, the patient may not be happy with the amount of stool they are passing. But trust me, passing once a stool in a day is good enough to be happy. But yes, I said that in that case, I will also may not be feeling happy when I reach that age. So things like this is acceptable. But but as caregivers, if my patient passes once a bowel, once or in maximum 2 days, I've got no objection to that things. As long flatus is being passed, there is no question of intervention regarding this constipation problem.
But I see so much of dependency on laxatives, sir. ये पानी का इंटेक कम होता है, हार्ड स्टूल होता है, या काफी सारे लोगों को IBS की तरह डिसेंट्री और कॉन्स्टिपेशन के बीच में होता है. एंड इतना डिपेंडेंसी ऑन लैक्सेटिव है दैट आई सी इन एवरी सीनियर के साथ जो भी घर है, एक लैक्सेटिव ऑफ एनी काइंड तो घर में है ही है सर.
That is what I've told you. कि जिसमें थोड़ा सा even if in my age I have not passed to say 1 day, so मेरा हेड में इतना जाएगा नहीं. मुझे पता है कि it's okay, we can do it on a second day. But the thing is that when we age up, these things doesn't become normal to us. I may feel uncomfortable while eating, uncomfortable because मुझे लग रहा है कि abdominal distension हो रहा है. तो ये सब थोड़ा होता रहता है. But in that case, we usually add a prokinetic जिसमें peristalsis थोड़ा कम हो जाता है with age. The pushing power of the fecal material थोड़ा कम हो जाता है in the intestine. These are, as I say, these are all physiological. इस एज के साथ साथ हो जाता है. डायबिटिक पेशेंट में और गैस्ट्रोपेरेसिस होगा और ज्यादा हो जाता है. So I am not saying that the patient is annoying. I am saying that the patients will complain. ये प्रॉब्लम उनको है. But we have to solve it out because at that age this becomes common क्योंकि इनका तो power हो गया ना.
Correct, sir. So that's about constipation, and yes, let's help our senior citizens out from recovering from this kind of constant pressure of clearing bowels. So next question is also very important. Mr. Arun Kumar Jain is asking this question. 67-year-old hai Arun Kumar Jain. What helps in recovering from short-term memory loss? Sir, he's opened up a Pandora's box. Elderly and memory जो fail कर रहा है, हमें बार बार याद नहीं आता है. I've seen people who recollect all their childhood days but immediate memory नहीं होता है. Is this normal aging?
This is normal aging. इसका साथ साथ aging के साथ साथ कुछ neurological problems आ जाता है. These are all common things. पहले ये थोड़ा कि delirium होता है कि patient कभी कभी पता नहीं चलता कि कहाँ है. They are not aware about their surroundings कुछ देर के लिए. कभी कभी delusion हो जाता है, कुछ think कर लेता है which is not absolutely real. Depression आ जाता है. तो these are all Parkinsonism होता है. These are all contributing to the neurological disorders in the elderly. But in that case, it is better to consult a physician or a neurologist and take an expert opinion and get a treatment. And absolutely, but treatments options are now available. 100% success rate reversibility है कि पूरा तो शायद नहीं जाएगा, but the thing is that improvement थोड़ा रहेगा.
In control. Yeah. So इसी के साथ हम अभी बात करेंगे seniors and their mental health issues के बारे में. Aging is a process which a lot of people cannot healthily accept. Two, they must be their life events which are traumatizing or pressure, काफी stress भी होता है life events की वजह से. तो अकेले रहने वाले होते हैं या family disturbances में होते हैं. मेंटल हेल्थ ऑफ सीनियर सिटीजन्स एंड उसका इम्पोर्टेंस थोड़ा बता दीजिए सर.
Unfortunately, this aspect is not taken. There is no department, there is no absolutely, there is no institution which take care of this, whatever the subject you are telling, this to take care of this subject in our society at this moment. But what happens is that after the age of 60, there are certain mental changes which we have to accept. Say, I'm first of all, after the age of 60, I'm jobless. Okay, I am retiring. So I have got no job. I don't have my regular work schedule. सुबह 9 बजे उठना है, नहाना है, खाना है, उसके बाद निकल जाना है ऑफिस के लिए, टिफिन लेना है. Absolutely gone.
Yeah.
So now I am thinking that थोड़ा जो मिल रहा है, I'm dependent upon that. First of all, there is an income issue. There is loss of job loss issue. Secondly, there is income issue. Thirdly, जैसे मैंने बोला है कि थोड़ा आँख में कम सुनना, आँखों में कम देखना, कान में कम सुनना. तो when somebody is discussing in an environment, I'm not able to recognize the person who is sitting सामने कौन है, क्या बोल रहा है, मुझे कुछ समझ में नहीं रहा है. तो I am not, even when in a gathering, I am not feeling I am with the family. I am feeling I am detached from them. तो थोड़ा थोड़ा करके मैं खुद ही आइसोलेट हो जाता हूँ, because I am not enjoying ना, मुझे कुछ समझ में नहीं आ रहा है. I am not पहचानिंग कौन पोता बोल रहा है कि पोती बोल रहा है, उनका कोई फ्रेंड है, वो लोग बात कर रहे हैं. I am not able to understand ये कौन है. I am not able to see. So these are all causing me to depression होकर के मुझे आहिस्ता आहिस्ता हटा देना है. Second is that the next generation, they are also busy. बेटा हो बेटी हो वो काम पे निकल जाता है, वो शाम को आ रहा है. They are also getting tired. I'm not blaming anybody. This is the normal thing. They are getting tired. When they are returning from their office in today's work schedule, how can we expect as a senior citizen कि वो मेरे पास आकर के 2 घंटे बैठेगा? Because he has some got work to do even after he comes back home. इनका प्रोजेक्ट वर्क हो सकता है, ऑफिस का पेंडिंग वर्क हो सकता है. तो एब्सोल्युटली ही इज ऑल्सो एग्जॉस्टेड. इनका जो बेटा बेटी घर वाला कुछ भी हो. सो all are contributing to this social deprivation. I understand, but one needs to understand that you have to accept it, क्योंकि आपको घर वालों को जो फैमिलीज में है, इनका भी कोई ज्यादा दोष नहीं है. So some responsibilities regarding the with elderly towards the communities, that whenever you see a senior citizen, just try to give them support, social support, दो उनसे बातचीत करो, so that not they are feeling isolated. Similarly, for home and for the home people, just try to be compassionate with them. They may be having some health issues, try to discuss with them, bring to the healthcare provider. They may be having some mental issues, try to discuss with them and give them whatever things you want to give. Give some safety measures to the elderly, that उनको adequate house में lighting दो, guards or siders दो at bed, windows, staircase, so that they don't fall. Bathroom slippery ना हो. Coloring of the house should be helpful in defining the doors and the stairs, so that they can identify doors कहाँ है, क्योंकि उनको साफ आँख में दिखाई नहीं दे रहे हैं. Noise should be controlled. Dust और थोड़ा cleaning में थोड़ा ध्यान देना चाहिए. And whenever एक बार families के लिए elderly को, they should not feel isolated, and they and try to minimize their risk of the falls. वो गिर ना जाए, so that you don't have to worry about the fractures and the OTs, etc.
Yes, sir. So yes, mental health is a very, very complicated topic, and I don't think we can continue talking here for more time. But yes, ध्यान रखिएगा, बड़े लोगों को उनका support is also, emotional support is also very, very important. Sir, two important things. ये एज में आते ही हमें डायबिटीज या हाइपरटेंशन बेस्ट फ्रेंड्स हो जाते हैं, उनके साथ जीना तो पड़ता है. हाउ मच डू यू हैव टू मॉनिटर कि एक बार मुझे मेडिसिन दिया गया है, आई हैव सीन लॉट ऑफ पीपल कंटिन्यूइंग द सेम डोसेज फॉर लॉन्ग. तो बड़े लोगों के साथ अगर हम लोग डायबिटीज एंड हाइपरटेंशन के बारे में, थोड़ा डोसेज के बारे में भी बता दीजिए सर.
एक बात देखिए, जो पेशेंट इंसुलिन में है उसको तो हर महीने, या जो पेशेंट ओरल हाइपोग्लाइसेमिक पेशेंट्स में है, उस ओरल हाइपोग्लाइसेमिक एजेंट्स में है, अगर कोई कुछ भी कोमॉर्बिडिटी नहीं हो, मैं धोत पकड़ लिया कि किडनी एकदम ठीक है, इनका हार्ट ठीक है, फिर भी महीने में एक बार डायबिटिक चेकअप या हाइपरटेंशन चेकअप स्क्रीनिंग कर लेना चाहिए, क्योंकि अगर बढ़ गया, सो दैट टू प्रिवेंट एनी ऑर्गन डैमेज, एटलीस्ट इफ इट इज नॉट
Right.
पॉसिबल इन अ मंथ, ट्राई टू डू इट इन 2 months, और मोस्ट अगर ज्यादा से ज्यादा डिलेड हुआ तो 3 months, but not more than that, because after that HbA1c level is going to be affected in case of diabetes, and hypertension
Right.
अगर ज्यादा रहेगा तो organ damage with diabetes वो तो कर देगा.
सो मॉनिटर करते रहिएगा, डोसेज रिक्वायरमेंट फिजिशियन के साथ बात करते रहेगा. अपोलो 24/7 has wonderful simple physicians available just a call away. So keep एक रेडी रहना चाहिए. अगर फॉल है तो फर्स्ट एड रेडी होना चाहिए, हेल्प रेडी होना चाहिए, एसओएस बटन्स रेडी होने चाहिए. So make sure you are providing everything. So here's an important question Yogitek is asking again for the father who's 65-year-old. So any supplements or along with the diet that you suggest for knees, for cartilage and other stuff, sir, one. And also supplement and the aging में आप थोड़ा रोल उसका भी बता दीजिए सर.
देखिए, डायटरी सप्लीमेंट्स, आई एम नॉट अ बिग फैन ऑफ द डायटरी सप्लीमेंट्स. वॉट एवर द नेचुरल सोर्स ऑफ फूड वी आर टेकिंग, it should be good enough. I have already spoken about the daily requirement of the calorie, fluids, and the daily requirement of the proteins, and the daily requirement of the fats as well. Or 20 grams oil मैंने बताया. You just try to maintain a normal balanced diet with the seasonal vegetables and herbs. Try to give poultries you can eat, give egg whites, anything can be given, just to maintain the calorie diet. And if the patient have some problem with the chewing of solid foods, then you give them something like poha, upma, पायश हम लोग बंगाली में देते हैं, तो you can try semi-solid foods like this. Even if he's or preferring a soft ice cream like that, you can give him. But the thing is that moderate quantity में सब कुछ चल सकता है. Don't give it in excess.
Right. So but calcium है, B12 है, या
Yeah.
other, yeah,
Deficiencies
है.
are there. Yeah. What now? You just told me a valid point. If the deficiency is there, there's a vitamin B12 deficiency, calcium deficiency, whatever we discussed earlier, anemia is there. These all are the categories which requires treatment, but these levels has to be monitored. But you can't give a patient vitamin D up dete rahiye. But what happens is that there will be the raised calcium, but जाने से वो क्या होगा, किडनी का creatinine भी बढ़ता जाएगा. There will be raised
Correct.
acute kidney injury as well.
राइट राइट. सो इम्पॉर्टेंट है सप्लीमेंट्स देना, पर कब देना, कैसे देना, डाइट के साथ मैनेज कैसे करना है, वो फिजिशियन के एडवाइस से ही करिएगा. टेस्ट करवाते.
हाँ, better to do it. Natural source में मुझे कोई प्रॉब्लम नहीं है, but whenever you're taking in forms of tablets or medicines or कुछ भी other forms of available markets में, वो मैंने हाई प्रोटीन देने से वो रेनल में थोड़ा लोड पड़ जाएगा. It's protein is not the solution.
ठीक है सर. ऑलराइट सर. वीकनेस, फटीग ऑल द टाइम. सो हाउ डू वी अंडरस्टैंड? सीनियर्स तो हमेशा ही थोड़ा they feel weak, they're not active like how youngsters are. So how do we help them here?
या देखिए, इनको अगर इस कैटेगरी में भी दो आएगा. अगर मेंटली वो वीक है तो थोड़ा मेंटल तो उनको बूस्ट अप नहीं करने से ही विल नॉट फील वेल. एंड इन द वीकनेस कारण में ये आता है कि थायराइड डिसऑर्डर्स होता है, डायबिटिक डिसऑर्डर्स होता है. अगर ये सब है तो वी नीड टू एज अ फिजिशियन वी विल बी गाइडिंग द पेशेंट टू डू द इन्वेस्टिगेशंस, और जो निकलेगा अकॉर्डिंग, अगर ट्रीटमेंट ठीक हो जाएगा. थायराइड डिसऑर्डर से भी थोड़ा मूड डिप्रेशन आता है. So when we treat this type of disorders, that things ultimately improves and the patient feels better.
All right, sir. So one quick question towards erectile dysfunction, जो हमने पहले भी बात कर चुके हैं beginning of the show में. But here's a question. Mr. Kumar, 70-year-old है. Erectile dysfunction and seniority में क्या help हो सकता है?
No, this has to be evaluated. You can't take the whatever the medicines are available in the market, Sildenafil or whatever medicines. You can't, better not to take it on self prescription, because there are a
करेक्ट
lot of
करेक्ट
things that has to be.
मार्केट में इतने सारे अवेलेबल है, एडवर्टाइज करते हैं, पर कौन से एज के लिए क्या है वो बताते नहीं है.
बाकी ऑल ठीक है, जो कम उम्र के लोग देते हैं, बट व्हेन द सीनियर सिटीजन देयर इज अ वेसोडाइलेटेड इफेक्ट ऑफ दिस ड्रग्स. So you need to be absolutely sure whether you are not on any beta blockers. आपका कोई vasodilator effect है कि नहीं. It is, don't do it outside the knowledge of the physician. It's a physician से बात करके जो जो आपका existing दवाई कौन सा दे रहा है, क्योंकि उसका दवाई के साथ भी introduction हो सकता है. तो
So
then you will.
this is one topic in our society which we feel taboo है, शेम है, शाई फील करते हैं कि बात नहीं करना है. जो साइलेंटली मिल जाता है वो साइलेंटली ले लेते हैं. आई थिंक इट्स इम्पोर्टेंट दैट वी ऑल टॉक अबाउट इट.
Yeah. This should be addressed. People usually don't discuss it, but whenever I'm saying that if it is, don't take it on a self prescription, because ना क्या होता है, ये ले लेते हैं, but the thing is that there will be some side effects like headaches, and इसमें होता है तब वो discontinue खुद से ही कर लेता है. But the thing is that better you avoid the side effects, because there are certain drugs which we cannot use with this type of drugs, and there will be certain side effects which I'm not discussing on this platform, which you won't be able to tolerate as well. So you better to consult with a physician and go per his advice if you wish. But the thing is that you can only do whatever you do, sir. You can only do planned sexual intercourse. You can't do it at will.
So I don't have time enough to discuss about prostate or postmenopausal issues of gender-based issues. But one quick word about कि ये क्या होता है, उसको कैसे ख्याल रख सकते हैं, gender-based problems in
देखिए, after that, prostatomegaly in case of males is common. Yeah, female gynecologist will be explaining better. But in general, हम short में बोल देते हैं, estrogen level थोड़ा कम हो जाता है. The protective estrogen level goes down, and the cardiovascular and other hypertensive effects और postmenopausal होता है, ये सब in females में थोड़ा बढ़ता है with after the age of 45-50. And in case of males, prostate hypertrophy becomes normal. The presenting symptom will be dysuria, urine करने में तकलीफ होगा. Only screening test is required is ultrasonography to see the size of the prostate. लेकिन वो साइज लग के डॉक्टर को डिसाइड करना है कि कौन सा दवाई क्या करना है, साइज प्रोस्टेट का साइज का ग्राम देख करके, वेट देख करके. एंड द नेक्स्ट थिंग इज दैट एक बार पीएसए लेवल हम लोग देख लेते हैं कि वेदर दिस इज एनी मैलिग्नेंट और नॉट. जस्ट ये दो चीज देख लेना है कि पीएसए लेवल देख कर कि वेदर दिस इज अ बिनाइन prostate hypertrophy. If it is a benign, you go on with the treatment after assessing the prostate size. And if it's a malignant, we should look for the PSA. If the PSA is normal, nothing needs to be done. If the PSA is not normal, then the prostate cancer treatment is highly advanced. Then we should go for the treatment with the consultation with the neurosurgeon. एक surgery लगता है और एक with the medicine. But medicinal treatment also can be continued. But the thing is that we can avoid a surgery as well in this case. But surgical consultation is required, because we have to see whether it has spread anywhere or not. Metastasis take care.
Correct. Right. So this is about, we could not entirely discuss all the organs like heart, lungs, kidney, but that's, understood, and each department can take care. In general, I think it was a wonderful information that you have given, sir. So to conclude, I want you to give us top tips to take care of our senior citizens.
Yeah, the top tips is that in the home is that be compassionate, take care of the physical ailments of the senior citizens, consult a doctor if they have any physical problem, prevent the falls at home, give the floors clean, floors non-slippery, keep the bathroom well lighted and non-slippery, use handrails so that the minimization of falls, and try to be compassionate about the senior citizens. Give them an ideal diet with seasonal vegetables and herbs, and try to give them adequate fluids. If they don't have any comorbidities, at least 6 to 8 glasses of day, and that should be good enough. And try to understand their problems, and try to make them socially active and interactive.
Right. Thank you, sir. There are a lot of people who have been asking us mental health and other vaccines के बारे में बात करने के लिए, but आज के एपिसोड में I
हाँ,
don't think we'll be
वैक्सीन्स में
able
छोटा
to.
सा मैं वैक्सीन्स में थोड़ा ऐड कर देता हूँ। सीनियर सिटीजन्स के
ठीक
लिए
है.
ये अच्छा टॉपिक है। वैक्सीन्स इंपॉर्टेंट है, मैं बात कर लेता हूँ। जस्ट इन अ वेरी शॉर्ट, pneumococcal vaccine, pneumonia vaccine to protect against commonly acquired pneumonia is required. Influenza vaccine should be given every year. Pneumonia vaccine, two vaccines that are there. One is given Prevnar 13 and the next year Pneumovax 23. And both these are all single dose once in a lifetime. Influenza vaccine every year has to be taken after during the monsoon months. They usually bring out a fresh vaccine, so it has to be taken then. Tdap vaccine, tetanus and other, they should be taken every 10 years. Shingle zoster should be taken, 2 doses of shingle zoster, and of course, don't worry.
That's
take
after
the
15, no, sir?
Yeah, and COVID vaccine is also mandatory to be those who haven't taken it as a
Yes,
COVID.
sir. Thank you for taking time about vaccines, which, as you said, are important. Wonderful, Dr. Amitava Ray. It was a great session and information. Thank you, sir.
Thank you. Thank you.
Namaskar. Namaskar. So that's Dr. Amitava Ray giving us inputs and information about senior citizen wellness. And here, this is your opportunity to win prizes from Apollo Hospitals. Now, I'm going to ask you 3 questions, and you can answer these questions only on YouTube chat. And our team will be selecting the names of the winners, and we will be announcing the winner's name towards the end of the show. And if you are selected as a winner, you will have to write back with all your contact details to marketing@apollo247.com, and the winners will be selected at the sole discretion of Apollo 24/7 team. Gift vouchers will be shared with you. आज के 3 questions है on the screen. The first one is fill in the blanks. A से शुरू होता है, AR blank H R blank T blank S. A से शुरू होता है, S से end होता है. This is a major health concern for many older adults worldwide. What is it? What is the condition? It's a health condition. A से शुरू होता है, S से end होता है. Fill in the blank. True or false? Walking is not recommended as an exercise for senior citizens. True or false? I repeat the question. Walking is not recommended as an exercise for senior citizens. Is that true or false? Question number 3. Yes or no में answer कीजिए. Nutrition supplements are equally important along with the right diet. Yes or no? This is a tricky question, so please continue answering. Here are the coupons that you can use on Apollo 24/7. Download the app and use the coupons. The first one that we are giving away is AskDoc 150, AskDoc 150. Consult top doctors from Apollo Hospitals, direct from Apollo, and you get 150 rupees cashback on consultation as well. This is online doctor consultation when done on Apollo 24/7. Download the app now. And the next one that we are giving away is first 3. You get up to 25% off on online medicine orders when you order medicines direct from Apollo. The code is FIRST3, numeral 3. You get a 2-hour delivery too if you order from Apollo 24/7. And exclusively for our Health Hour viewers, here's HH247. You get 199 off on online consultation with Apollo doctors and 20% off on medicine orders as well. So go on, download Apollo 24/7 app and enjoy the benefits of entire Apollo hospitals. And also you can access Apollo now through the Apollo 24/7 through WhatsApp as well. They're just a call away, or you can text as well. WhatsApp pay 9355247247. I repeat the number 9355247247. Save the number to avail healthcare services. So that's it for this week. And next week we are going to talk about a very interesting subject. थकान, सुस्ती और कमजोरी, इनको कैसे दूर करें? 12th में 11 AM we are going to talk about this. Thakan, susti, kamzori, weakness, fatigue and tiredness, all of this, how do we keep them away from our, and how do we stay active? We're going to discuss all about this on the next episode. 12th May, 11 AM, join us. The winners for this week are Dasari David, Yogi Tech and Teji. I repeat, Dasari David, Yogi Tech and Teji. Congratulations. Please write a mail to us at marketing@apollo247.com with your details like contact, name, address and number, etc. So we shall get back to you and share the gift vouchers with you. Thank you all for joining us. Your questions are answers for many. As usual, it was an interesting session because of your questions. Keep participating. Namaskar.